Thank you, Mr. Chairman. This is straightforward, and let me say first and foremost how much I've appreciated the discussion this afternoon. And I think the issue of primary health raised by Mr. Blumenauer, Mr. Schmucker, and others has been informed and insightful. My concern, as I stated from the start, and will always say on this committee, as is Mr. Bartold underlined, is that this is a direct hit on the Medicare and Social Security Trust Fund. So the amendment's pretty straightforward, Mr. Chairman, and it'll take me a second to read it, that the provisions of this act, including amendments made by this act, shall not take effect if prior to December 31st, 2025, the Secretary of the Treasury, after consultation with the Social Security Administration, determines that such provisions will reduce aggregate receipts to either the Old Age and Survivors Insurance Trust Fund or the Disability Insurance Trust Fund. Look, we're in a crisis. It's staring us. 10,000 baby boomers a day become eligible for Social Security. There hasn't been congressional action to address this in more than 52 years. This isn't benign neglect, and yes, both parties bear responsibility for this, but it's this committee's responsibility, the Committee of Cognizance, number one, to protect Social Security, and that's what this amendment seeks to do, but number two, also expand it. I say to my colleagues on the other side, because I know of your interest in protecting the individuals in your district, there is no better economic development plan than Social Security, because those very people that need it the most, those on a fixed income who are hurt the most by inflation, haven't seen any enhancement in 52 years. 23 million Americans would get a tax cut under our provision. We have a plan, and that's what's wrong sometimes in Congress. You have a plan, you put it out there in writing, there ought to be a vote on it. And people ought to know where you stand. And in this case, it's about the 5 million fellow Americans who get below poverty level checks, most of them women, because they were care providers. Isn't it long overdue that we lift them out of poverty? It's great that we can provide tax cuts for other people and the wealthy. God bless them. But how about we take care of those who have also, as Mr. Kelly notes, paid in with their own money? This is no entitlement. This is money they have paid into the program, and they deserve it back by way of a credit. We don't have to go back to 1929 to look at the great crash. You only have to go back to 2008, 2009, and where people watched their 401k become a 101k, where people saw during that same period that Social Security never missed a payment because it's the full faith and credit of the United States government. That's us. And we're responsible. And here we are on the midst of a government shutdown, which again, I hear from the other side that's not going to happen, so we're heartened by that. And where we're facing this crisis, and we need to act, and we need to act now and vote. That's what this amendment is about protecting the trust fund and making sure, as Mr. Bartold has laid out, that that hit doesn't come at the expense of an otherwise well-intended notion of a health savings account. And with that, I yield back.